All right, all right. Welcome, everyone. So glad to see you on here. If you don't already know me, my name is Dr. Vivian Asamoah. I'm an integrative gastroenterologist in Houston, Texas. And you may be watching this because you're part of our private Facebook group, Natural Gut Relief, where we talk about everything that can empower you to help heal your gut as naturally as possible. And once a week, we bring on an amazing guest, one that really aligns with our philosophy and has wonderful information to share with us about gut health, right? And today is no exception. I am so blessed, and you guys are so lucky to have Dr. Roxanne Pero with us. Some of you may already know her from Instagram. She is a national speaker on multiple topics, but I will let her introduce herself. Roxanne?
Thank you, Vivian. Thank you so much for having me here. And, I hope this conversation, even for one person, shed some light on any gynecological concerns that they're having in relationship to their gut symptoms as well. But, I started off as a traditional OB-GYN, and I love delivering babies and doing surgeries for 11 years until it kind of just clicked. And, I think for me, it was probably just that transition into perimenopause and seeing like how many symptoms I was having and realizing that a 15-minute conversation with my gynecologist once a year wasn't going to cut it for me. So it probably wasn't going to cut it for my patients. And so left private practice, did my certifications in lifestyle medicine, functional medicine, and I've been an integrative gynecologist for the last 4 years and love every minute of it. So I kind of miss delivering babies, but not the night, not the hours.
So delivering babies, yes, you are bringing lives to the earth, right? But in what you're doing and going a more integrative and holistic route, you are renewing lives in some way.
Exactly.
Isn't that awesome? You are renewing lives. So
Really
your
is.
practice is based in Dallas, right?
Correct.
Okay, awesome. So I thought it would be really cool to have you on today because I get a lot of referrals from gynecologists, OB-GYNs, right, for different reasons. I think the first reason is probably primarily because a lot of women use their gynecologist as their primary care doctor, right?
Absolutely.
Yeah. They see them once or twice a year, and usually they are the first ones to recommend all the preventative wellness stuff. Like, have you had your lipids checked? Have you had your mammogram? And have you done your colonoscopy? So I get a lot of referrals for colonoscopy once our patients hit 45 or have a family history and come in sooner. But then I also get referrals when they're not sure what's going on because the organs live in the same zone. The uterus, the ovaries, that entire pelvis sits right in that abdominopelvic wall cavity. And so it could be a GYN issue or it could be an intestinal issue. And so when you were in your traditional OB-GYN days, why would you typically refer to GI, Dr. Pero?
Right. Whenever we're in conventional medicine, we work in silos,
Okay.
So if someone was having bloating prior to PMS, send them to GI. If someone was having the period flu with the diarrhea, send them to GI. Abdominal pain, before I ruled out things that could be gynecology related, well, let's send you to GI and get it checked out. And now that I'm in my integrative brain, I don't even know how to separate those two anymore. It's amazing that I even practice like that.
Oh, so there's been a huge shift in your approach to patients, right?
Huge.
Huge. I feel the same way in terms of GI symptoms or patients who think they have GI symptoms, and I'm really worried about something else that is hormone driven in patients, right? How has your approach changed? Like, so now you have a patient with constipation or bloating, you're not sending them to GI anymore. What are you doing differently? How would you say that philosophy or that training has changed how you would approach a traditional patient with bloating, for example?
Yeah, so definitely not initially, I think now knowing, especially functional medicine with a gut first approach, we're going through nutrition recall, we're talking about stressors, we're talking about alcohol, toxin exposure, we're talking about gynecological symptoms as well, with the bloating or the constipation, are you also having heavier periods or missed periods or cramping with your periods? And so it just that subjective, that history taking just gets blown up compared to the questions that you would normally ask them in a conventional space when you have that integrated functional brain.
So you're connecting the dots a lot more based on the whole body system approach, right? You're really looking at what else is going on. And have you seen, and this is, I just want to know for information, right? But have you seen gut symptoms show up in different hormonal phases? Like I'm just talking like from puberty to postpartum to perimenopause or menopause. Can you say, most of your patients with menopause have this or suffer from this? These are the common symptoms I see.
100%. Just like you saying, like before we started, like you don't really recommend probiotics for children. We know that their gut microbiome is maturing, and puberty is associated with so many shifts in their gut microbiome. Like how could you even expect to know what right probiotics to give someone as that's evolving? So that's one thing. We know for pregnancy that we have huge shifts in our, not only our gut microbiome, but our vaginal microbiome. For perimenopause and menopause, as we see progesterone levels decline, for so long we've been told, well, progesterone supplementation is only if you have an intact uterus. We now, right, it's starting to get more disseminated. Hey, progesterone is for gut health as well. It has impacts for motility. It has impacts for immune function. And then, estrogen, we know that there's an estrobolome, that we have estrogen metabolism that's impacted by our gut microbiome. So we may be seeing changes in constipation, diarrhea, more bloating with perimenopause and menopause. So we absolutely see the impacts of estrogen, progesterone, hormone changes from phase to phase throughout our life.
So interesting. And so those are sort of naturally releasing hormones. What about synthetic hormones, like someone on oral contraception or HRT? What kind of effects do you see? I think I want to focus mostly on oral contraception, because that's I get all the time. Is my oral contraception affecting my gut? Is it affecting my microbiome? Is it affecting motility? I'd love to hear more about that.
Exactly. We don't have a whole lot of research on how it impacts gut microbiome and, the risk for development of leaky gut. But we know that in populations that consistently take oral contraceptives, that their risk of IBD, like Crohn's ulcerative colitis, is increased. But we still don't know the pathology on why it does. We know that combined oral contraceptives, because they're a synthetic type of estrogen, they're not body identical, they're 100 to 200 times more potent than our body's normal
naturally.
They're going to do a number on liver when they need to be metabolized. We know that they increase our C-reactive protein, which is a marker for inflammation. So I think anecdotally, we see more leaky gut and dysbiosis with women on combined oral contraceptives, but we don't have the data to back that up.
To really see exactly what's going on from a microbiome shift standpoint, and also from, there's some interesting data on the effect of medication on the microbiome that was published. I think it was a European study. I believe it was something done in the Netherlands. And it was looking at the effects of acid blocker medications like PPIs on the microbiome. It was looking, of course, at easy things like antibiotics and statins. And I'm going to go back and look at the data and see if there was anything on oral contraception, because it was like a pharmacobiome study. Where we were looking at the impact of these medications. And clearly we see that some of these synthetic medications can have a significant impact and shift on the gut microbiome for months and potentially even years, unless the medication is removed. So that is actually really important. Yeah, I think that's interesting to look at.
And we know that oral contraceptives deplete nutrients like vitamin E, selenium, zinc. We know that vitamin E, zinc are helpful for that gut barrier integrity. So again, it's like connecting the dots and what research do we have? I think we're getting closer and closer to kind of.
We're getting closer. Selenium and its impact on the thyroid, like so many things, it's like a cycle, really. And that's why you really have to connect the dots. From a GI perspective, when I see patients referred for pelvic pain, very often our gynecologist is thinking, hey, I want to make sure we're ruling out cancer, or we're ruling out ulcerative colitis, some kind of inflammatory bowel disease, Crohn's disease or whatnot, right? I'll do upper endoscopy, colonoscopy, imaging, and not necessarily find anything. And usually I send the patient back and I say, hey, this could be endometriosis. And we do know of the connection between endometriosis and inflammatory bowel disease. I mean, that connection is there. In your integrative practice, in your integrative gynecological practice, how do you approach endometriosis or a patient who you suspect endometriosis? How has your approach differed now as compared to when you were in a conventional practice?
I don't always like to say, well, I have endometriosis just because I did this or I did that. This is, what you should do. But when I was in conventional medicine, there weren't really any other options. So it was either surgery if you were thinking about, planning for fertility, or it was, oral contraceptive suppression if you weren't. And in my integrative practice, I still keep those on the table for them, but
As options.
And as options, absolutely. Women come in with debilitating pain. What's going to help immediately is suppressing the hormone production. And so I'll start them on oral contraceptives, but again, supporting the nutrients that are going to be depleted from that. I tend to put surgery on the table as, hey, I really want you to get surgery, but before you get surgery, so we know that just like you said, endometriosis and it's linked with IBD, it's linked with IBS. A recent 2025 study on SIBO and endometriosis showed that 90% of women with SIBO already had a confirmed diagnosis of endometriosis. So those are opportunities where we can treat and immediately reduce inflammation and put that patient in a setup for a successful surgery that's not going to be complicated with a lot of inflammation and scar tissue, and then get them to a point that after the surgery, we've healed the gut, we've removed the endometriotic implants. And I recently had a patient that we did exactly that. We treated SIBO, she went for her endometriosis surgery, and 2 months later, she got pregnant after 3 years.
Oh, that's amazing. That is so good. So truly, Dr. Pero, a combined approach, right? Really
Absolutely.
a combined approach, right? And how do you counsel your patient when it comes to nutrition? Your patients who are coming in with a presumed or known diagnosis of endometriosis. This is where our focus is different, right? In that foundation that we're trying to set with the patient, we're not just going to give you oral contraception and have a nice day, or we're not going to give you just a couple of supplements and have a nice day. What's your approach like overall?
Yeah. So again, I think after we rule out things like SIBO, IBS, food sensitivities, I think getting back to the basics, intuitive eating, when I eat X, how does it make me feel? Going back to as many whole foods, real foods as possible, eating nutrient dense, eating the rainbow, our polyphenols, antioxidants, supporting with anti-inflammatory foods. And that usually involves, a dietitian, a health coach, someone to guide them. It seems so easy, just eat real food and eat the rainbow, but to put it into practice to make it so that it becomes frictionless for a patient, that's really where, a team-based approach with integrative medicine is key.
Is helpful. Okay. That is, I think, a very important approach that will lead to sustained relief for a lot of patients, because endometriosis is often, I think, a pathology that never completely goes away, except, of course, postmenopausal, right?
Exactly.
You do not see symptoms anymore. So the earlier it is diagnosed and not confused with diagnosis like IBS, because a lot of our female patients with endo have IBS. They've been tagged with a diagnosis of IBS for so many years, and no one has explored deeper to find out what's triggering the symptoms that we're calling. That's actually really, really important. So tell me a little bit about your approach to PCOS. Must be similar.
Oh, yeah, absolutely. For so many PCOS patients, I tell them, even if you're not having constipation, diarrhea, GI symptoms, I guarantee if we can focus on restructuring your nutrition, identifying what your gut microbiome looks like, and personalizing that. That we see a lot less diversity in PCOS women's gut microbiome. We see less akkermansia, less lactobacilli, and we tend to see less short chain fatty acid production because of that. And we know that prebiotic rich foods, fiber rich foods can help to feed the gut microbiome to produce those, which are an anti-inflammatory. And because PCOS is like, well, what is causing this? And we have different variations. Some women are inflammatory, some women are androgen, some women are insulin resistant. Regardless of what you are, it still comes back most of the time to your gut health. What are you feeding your body that is causing your androgens to be elevated and you're not metabolizing them? What are you feeding your body that's creating insulin resistance? And so we really work on high fiber, nutrient dense foods. Some of these women have eliminated everything: dairy, corn, chicken, beef, like everything. And then they're not even feeding themselves just the basics of what they need to ovulate and to thrive. So working through what's become food aversions, just teaching them to be safe with eating the variety of foods. And it's just more about the content of those foods.
Awesome. So let me know if you ever use the strategy of intermittent fasting or fast mimicking diets in some of your patients with PCOS, especially those who you believe this is truly an insulin resistance issue, right? Like PCOS, fatty liver, plus they have all the other signs of metabolic syndrome. Are there some personalized approaches that you've seen in terms of nutrition be super successful beyond just a wholesome, diet rich in polyphenols and et cetera?
Yeah, I tend to just based on their relationship with food. If someone's already has a restrictive diet, I'm probably not going to recommend time restricted eating windows at that time. I want them to feel safe, to feel comfortable with getting back into eating real food, lots of it. But for many PCOS women, absolutely they benefit from time restricted eating. And so we tend to front load their days, have them eat good healthy breakfast, eat a medium lunch, and then go a little bit less
for dinner. Okay, makes a lot of sense. So I really would like to know what your thoughts are on the wave of hormone replacement therapy today. There's been such a huge shift in the last 5 to 10 years. And I think the FDA is actually, I think the Senate or whoever, there's a new bill, right, in hot debate right now, hot discussion about better education for physicians in general when it comes to menopause, right? Perimenopausal symptoms and menopause. And I'd love to hear your perspective because you're sort of like the first GYN I'm talking to during this transition. What was it like before in practice? And what is your practice like now? And how do you think things are going to evolve in terms of managing menopause? Because I'll tell you this, my grandmother is telling me I never took hormones, I'm fine. But what's your take?
Yeah, so in years past when I was in conventional medicine, it wasn't much talked about. But we didn't even really address perimenopause. We'd be like, okay, well, let me know when you've gone a year without having a period. And then, I'll really guilt you about starting hormones and their increased risk for cancer and blood clots. And if you want to take on that risk and be cavalier with your health, then go for it.
Go for it. Oh my goodness. Wow.
So it was not prescribed very often. And so now, honestly, I love this renaissance period for women. I absolutely love it. It's getting the facts, getting the hard science.
The evidence, yes.
Yes, getting the evidence showing that since the Women's Health Initiative, there have been 25 plus well-done studies that have negated those increased breast cancer, increased clotting risk. And more practitioners feel comfortable, especially with bioidentical hormones for women. I think where we need to be mindful is that we don't overshoot things and it swings back the other way. The hormone replacement therapy still needs to be in a comprehensive context of, okay, you're still taking in hormones that need to be metabolized. They need to be eliminated. If you're drinking alcohol, if you're still eating a high fat, low fiber diet, how do you expect your body to do what it needs to do for the positives of why you're putting in hormone replacement versus the negatives of what, poorly metabolized hormones will do, So I don't want it to swing the other way. I think it really needs to be where we're talking about.
I love that you're saying this because I feel exactly the same way. A lot of people are getting the training, right? Okay, yeah, you can prescribe vaginal estradiol, you can get testosterone, you can do this. But what if they're not eating healthy? healthy,
Yes.
right? They're really not getting the right nutrition and they're not getting the right supplements and they know nothing about the methylation status. They know nothing about how their liver detoxifies. I mean, these are pretty potent doses. And I think that's the starting place. This conversation is important, but we shouldn't shy away or completely ignore the elephant in the room, which is that we are just eating a ton of processed food and there's a lot of toxins in what we're consuming right now. And that's one thing I love about you, Dr. Pero. You talk a lot about detoxification and the importance of identifying where toxins are coming from around you, your everyday life. Touch on that a little bit and the impact on that gut hormone metabolism and that gut hormone balance. Super important.
Oh yeah, absolutely. I mean, we know that, things like PCBs, which are persistent organic pollutants, they're everywhere. They're in the air that we breathe. The higher you go up in the animal food chain, the more concentrated they are. Exposure to those has been associated with endometriosis, with fibroids, BPA, phthalates, increased risk for PCOS. So these are disrupting our hormones. So again, yeah, how do you expect to put hormone replacement therapy in, but we're seeing these hormone disruptors still coming in? We're not optimizing our health just by us taking it. And again, we've learned through antibiotics, right?
Mm-hmm.
There's
Yes.
But if you're going to use antibiotics, do it the right way. Still plan on supporting your body after those antibiotics. And so I think, yeah, we just need to be talking about the whole picture for
Yes. And use them judiciously, right? Use them judiciously. So how would a patient know, how would a female patient know if her hormone therapy was either not working or if truly we're overshooting in terms of the therapeutic response? How would she know? What kind of symptoms would they expect?
Yes. So for something like estrogen, I personally like to, especially in the first year while we're working on getting things right, there are therapeutic levels. Again, if you haven't been trained on this, you may not know what therapeutic levels are. You may not be monitoring them. So I like to check estradiol. I like to check estrone levels. I feel like I'm plus minus if a patient wants to get something like a Dutch test done to check metabolites. They've got a family history of endometriosis, fibroids, breast cancer, and they have the funds to do it. 100%, let's do it. But again, just supporting that hormone replacement. So blood work, but then also like I tell them, hey, within the first couple of weeks, your hot flashes should go way down. You should
There
be
you go.
sleeping
You should be
better.
looking for response. Yes, response.
Exactly. So estrogen, pretty potent enough that you should see improvements within a couple of weeks. Progesterone, pretty potent enough that if you're taking it at night, you should feel like you're sleeping better. Testosterone usually takes a little bit longer to see the impacts of it, right? Because it's helping with libido, and we know that that's multifactorial for women. It's helping with immune system function. It's helping with muscle building, with fat loss. So those aren't things that we're going to see within the first few weeks of it. So, but that's when it is important to check blood levels. And like I said, even for peace of mind, I think women still, I think in the back of their heads are like, okay, is this really safe for me? I want to be on the lowest dose possible that's going to give me relief, going to help with longevity, help with cognitive function, bone health. So I think it's worthwhile for all parties involved to stay on top
to check.
of testing.
And how often would you check? How often do you recommend that they get?
Yeah, the first time I put a patient on hormone replacement therapy, I usually check 6 weeks later. And then after that, depending on what the levels are, it might be 3 months after that, and then 6 months. And then when they're on a dose that is steady, then once a year.
Perfect. I'm going to circle back to the question of detox and what you're doing, what you do in your everyday life. We're going to make it personal, but how should a female patient know when the hormone replacement therapy is off? Like it's just too much. What are some of the symptoms that you want to highlight for them to go talk to their gynecologist or whoever the prescribing physician is?
So especially when you're in perimenopause and starting hormone replacement therapy, periods may get pretty wacky, okay? Because that's the whole point of, that's when perimenopause, that's the hardest time. I mean, menopause yeah, I mean, some people are sad about finally getting to menopause, but that's when, balancing your hormones is a lot easier because you don't have your body that some months is ovulating and making hormones, and then you're adding hormone replacement on top of that. And so you can get kind of estrogen dominant symptoms. You can have bloating, you can have weight gain, you can have acne, breast tenderness if you have too much progesterone, hair thinning,
more anxious, more irritable, right?
yes,
Yeah,
yes,
if
yes,
it's too much. Yeah. Yeah.
yeah.
All right. So, final question. This has been a wealth of information, and I'm sure everyone is really excited to learn more and also follow you on Instagram. And you have tons of great information that you share.
Yeah.
I particularly love the information that you share about detox protocols, what to do, how you become aware. So, in your personal life, Dr. Roxanne, how are you avoiding these toxins? What measures, what are some of your hacks? What are easy things that people can take away and do today to minimize the impact of toxins in their system?
I think that this was probably one of the more overwhelming things for me with functional medicine, even just thinking that I have to think about detoxification, But then again, just like I was telling a patient today, it's all about perspective, right? You can either let it overwhelm you because it seems like so much and you already have a lot on your plate, but you can also spin it as, wow, there are things that I can do that ultimately is low hanging fruit to really improve and reduce your risk of toxic exposure. So hydration, that's an easy thing, right? Make sure you're hydrated and drinking. And if you're the kind of person
Clean
who,
source of water, a clean source of water.
yes, exactly. So a simple, pitcher that you're refilling, or even the under the counter water filters are great. You don't have to have whole house filtration. You have the means to do it, great, but just start somewhere with clean water and drinking lots of it. I tell patients about just sweating with movement, exercise. And this is a big one that I push on my Instagram is, especially working women or moms, if you have time to take your kid to 5 different after school activities, you better find the 20 minutes to work out
To
and
do
move
some
your
squat.
body and to sweat, okay?
Yeah.
So we know that that's helpful. And then just being mindful of the food that we eat. I think that, I had sent you, there's just so much for every subject on social media. You can find 2 truths to it, okay? I feel better when I eat organic. We know that certain pesticides that are associated with non-organic foods have an increased risk of endometriosis and PCOS. So I try to go organic as much as I can. Again, eating real food. Cheese is one of those things that so many people love, but the processing from the moment that it comes from a cow to the second that you pick it up from the grocery store, it has had so much plastic, persistent organic pollutant exposure. We want to be mindful of how often we're eating those types of foods. And then, like I said, the same thing with meat intake. Your bigger meats like beef, they're going to have higher dioxin levels because they're going to accumulate. So having those less sparingly, doing meatless Mondays, and then just eating foods that are naturally going to help with detoxification, cruciferous vegetables, green leafy vegetables, for sure.
I love the fact that you're saying this. You haven't spoken about go buy this and go buy that and go buy this PMF and go buy this and go buy. It's basically start wherever you are, just meet yourself. Don't make it overwhelming. Easy things, sweat it out, eliminate by drinking, pooping, because I'm a GI doc. Food, how important pooping is on a regular basis to detox, right? Reducing meat consumption, increasing plant-based foods, increasing foods that are rich in sulforates and cruciferous vegetables that are going to help your liver go through that phase 1, phase 2 detoxification. I think those are some foundationals that you want to definitely stick to. And then you can take it up a notch. What are you using in terms of detergents? What are you using for your family in terms of your skin, right? What kind of makeup are you using? So there are levels of it, but I think that foundation is really, really important. Roxanne, this has been a wonderful conversation. I have learned so much, and I'm sure the audience has as well. And so for everyone who are you still accepting new patients, and are you doing virtual visits? Tell us a little bit about that.
I am accepting new patients, but might take a little bit longer to get in, but I always encourage patients, like, especially if you're having a hard time with endometriosis, infertility, those are things that, like, I'm really big on. I feel like I am able to relate to patients and I connect very well with them. So if you're having a hard time finding a practitioner that is working with you and that you vibe with, and it seems that you can't get into me to see me for 3 months, DM me. Like, I will work my hardest to figure out how to get you in sooner, I promise. I also have 2 great nurse practitioners who can see you, and we can do combo visits where I'm sitting in with them if you can't get in with me. And I am licensed in California and Colorado as well.
Oh, that's awesome. Good to know. Good to know. So yes, accepting new patients may take a while, but she'll try and get you in. And this is virtual, so perfect, right? Do you have
Yes.
brick and mortar? Do you see patients in person?
I do.
You do.
I see patients in person, yes, because I still do annual pap smears.
Okay.
I still manage abnormal bleeding. I do ultrasounds, microscope exams. So, but I also do telemedicine too.
Fantastic, fantastic. This is what I love. Physicians who are combining the best of both worlds.
Right.
Integrative functional medicine, lifestyle medicine. This is fantastic. We're going to put your details in the comments below. And this has been great. And we'd love to have you on again talking about a different integrative GYN topic. We should talk about MCAS now that we're becoming MCAS gurus.
Yes.
We should
Let's geek out for sure.
We need to talk about that. All right, everyone. I hope you enjoyed this. Again, my name is Dr. Vivian Asamoah. We were delighted to have Dr. Roxanne Pero, integrative gynecologist, on with us tonight, talking about removing the bridges, removing the silos, and connecting the whole person between gut and hormone. If this helped you rethink your gut health, like, subscribe, and share it forward. Follow us on Facebook at Natural Gut Relief for more tips, videos, and live Q&As. Thanks for watching. Your gut will thank you.